Diabetes mellitus is a rapidly growing chronic disease affecting around 451 million population people across the world. It has many complications associated with it, but diabetic nephropathy is one of the major microvascular complications, which in turn is the leading cause of end-stage renal disease. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be talking about an early prognostic indicator, that is the urinary podocin, to detect renal injury in diabetic nephropathy patients. The development of diabetic nephropathy, it demands an early detection, which is often aiming to decrease the incidence of the end-stage renal disease incidence. Now, podocyte injury is an essential element in the diabetic renal disease occurrence and also its progression. Now, the researchers in their recent study published in the Journal of Associations of Physicians of India, they attempted to identify these podocyte markers in the urine of the patients with and without an overt diabetic nephropathy. All these in comparison with controls to diagnose an early podocyte injury. The study included type 2 diabetic individuals, with 45 of them having normoalbuminuria, 40 patients with microalbuminuria, and 40 of them with and 45 non-diabetic healthy controls. Urinary podocin quantification was done among all these patients, and it was all compared among the different groups of the study along with various other parameters. The study found that the fasting blood sugar, the postprandial sugar, glycosylated hemoglobin, the triglyceride levels, as well as the duration of diabetes along with the systolic and diastolic blood pressure, the BMI, all seemed to be strong risk factors for the diabetic kidney disease progression. The glomerular filtration rate showed significant negative correlation with the levels of podocin excreted in the urine, whereas urinary podocin positively correlated with the fasting blood sugar, the postprandial sugar levels, the glycosylated hemoglobin, the triglyceride levels, as well as the duration of diabetes, along with the systolic and diastolic blood pressure, the BMI, microalbuminuria, and the urine albumin creatinine ratio. So it was hence concluded that the urinary podocin can seriously, or rather act as a severe early marker for diabetic nephropathy, as well as a marker of disease progression and severity among the patients with type 2 diabetes. So the standard risk factors definitely need to have been identified early as well as controlled in order to slow down the progression of diabetic kidney disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.